Hello and welcome back to another episode of the Pharmacist Diaries podcast. You guys are in store for a treat as I introduce a 6-part series about becoming a consultant pharmacist in the UK. Each episode is going to be packed with information, inspiration, and motivation for you to start your journey to becoming a consultant pharmacist. Whether you're newly qualified or many years into your journey, this series will provide you with so much education and tips along the way. This series includes information about the clinical skills and the competencies that you need in order to become a consultant pharmacist. We're going to be looking at the variety of specialist areas that you could potentially go into, as well as the challenges and achievements that you could have along this journey. We're going to be looking at work-life balance for consultant pharmacists, as well as managing stress and reducing your risk for burnout. We're also going to hear from a consultant pharmacist who has worked directly with the Royal Pharmaceutical Society and has insight into the actual competency framework and keeping it up to date. And then we're going to dive into the different sectors that you can actually work as a consultant pharmacist. One of our guests is actually working between primary, intermediate, and secondary care with her consultant pharmacist role. I cannot wait to share these stories with you, dive into the lives of the pharmacists who have actually created this journey, and actually showcase the profession from a different lens. Are you looking for natural ways to stay healthy? Welcome to The Naked Pharmacy, Europe's first plant-powered online pharmacy. They specialize in scientifically proven natural remedies and supplements, and their mission? To help you stay fit and healthy using the power of plants without the side effects. At The Naked Pharmacy, they use high concentrations of unique, high-quality plant ingredients to create effective supplements. Modern research shows that with the right strength, natural supplements can help prevent and relieve illnesses effectively. They blend the best of current science with traditional medicine to create quality health products rich in bioactives. Their supplements offer significant health benefits, and they can be safely combined with conventional medicines too. If you want to discover the power of nature with The Naked Pharmacy and take a leap towards a healthier you, head on over to their website, thenakedpharmacy.com. As a gift from me to you, you can get 20% off your purchase using discount code PD20. Today's journey is from a friend of mine and an ex-colleague from the Evelina, Sukeshi. I'm really excited to actually showcase her journey as my friend, but I'm also excited to learn about the actual motivation behind her journey. She's got 25 years of experience as a hospital pharmacist. She's a paediatric specialist currently working in respiratory and has a special interest in asthma. So her journey into becoming a consultant pharmacist links directly to paediatrics and asthma. She loves research and is really keen to understand medication adherence with asthma patients who are children, as well as vaping in children as well. So I'm really excited to showcase that journey, and let's introduce Sukeshi to the podcast. Hello, Sukeshi.
Hello, Anisha.
So happy to have you here. This is the kind of kickstarting our journey with consultant pharmacists and everything that you guys do. But before we dive into today's topic, why don't you tell us a little bit about yourself?
Okay, so it started a long time ago because I'm quite old. So effectively, you do your A-levels and things like that. And then after that, it was my brother that said, look, pharmacy is a good career for you. I actually didn't want to do pharmacy. I was more interested in doing mathematics, which was my pet topic at the time, and I was good at this. But I went along with him because he was doing pharmacy, and so I thought, okay, I'll do the same. So I got into university. My first year, I didn't actually like. It was very pharmaceutics and chemistry, and I thought, oh, this doesn't quite relate to patient care, which is what I was really interested in. And in those days, and the university I went to was very focused on pharmaceutics. Eventually, though, I went off and I started my career at Central Middlesex Hospital, And then my journey just took off because the pre-reg project I did won an award. And then I thought, oh, this is good. Maybe this is something I'm good at. And then I was lucky enough to get placed at St Mary's and had made a lot of friends there. And then, quite by chance, I ended up at the Royal Brompton Hospital. And there I was introduced to paediatrics. And I absolutely loved paediatrics. It was all paediatric cardiorespiratory medicine. And it was amazing. It was really interesting. And, started on PICU, did a lot of rosewood, so cystic fibrosis, asthma, anything respiratory, anything cardiac. And then I had my children. And at times like that, you give up a couple of things. So I went off and I did other bits and pieces like community pharmacy, worked for Boots. And then eventually I went back to Harefield, which was part of the Royal Brompton and Harefield Trust. And there I worked in adult services and then as part-time. And then it came about a job share role at the Royal Brompton in paediatrics. And my passion has always been paediatrics. So I went back there to paediatrics and just started doing bits and pieces and led the service. Then eventually an opportunity came up at the Evelina. And during this time I did my MSc and realised in asthma. And I realised there's so much to do. It might look like a disease that everyone knows about, but doesn't have that many inhalers and doesn't seem to be complicated on the surface, but it actually is. And I realized during my MSc and during that time that actually there were so many asthma deaths in children, and I felt that I could do something about it just by educating people on it, educating children. And to be honest, I would like to see asthma in children as a never event, a zero event. It shouldn't happen. And so that's where my passion came in. And so, so here I am at the Brompton and at the Evelina doing a lead pharmacist role and respiratory pharmacy.
I love that. And thank you for sharing that with us as well. And it's really interesting that you talk about becoming a parent and your journey sort of transitioning into a different area of practice, because I'm going through that journey obviously at the moment. As a lot of people know, I'm a parent of 2 young children, and my journey into pharmacy is evolving and changing because of the fact that I want to be at home a little bit more and my career journey is shifting. But it was nice to hear that you spent that time with your children. You still worked as a pharmacist, enjoyed what you were doing, but you came back. You came back into the hospital setting and you dove headfirst into becoming a consultant pharmacist and doing lots of other further education, as well as being a chair and a co-chair for national organizations. You have so much sort of kind of courage after parenting young children and kind of getting through that journey, because it's not easy. So I commend you for that. And it's an inspiration for me to see what life is going to look like going forward for me once my children get a little bit older. Today's episode is all about the kind of clinical skills and the competencies that we need to become a consultant pharmacist in the first place. So I guess my first question to you is, what are those skills and competencies that are needed in order to become a consultant pharmacist, and how do they separate us from kind of pharmacist roles that are specialist, whether you're an 8B or an 8A and you're in a specialist field? But what are the differences that you see in terms of the skill set?
So effectively, from my point of view, everyone's point of view is different. From my point of view, it is a consultant pharmacist is someone that is able to work autonomously as well as within a team, but at a local, national, regional, and even international level. And that's what separates a specialist with a consultant, that you're a little bit far-reaching, a lot more reaching other people, and being able to have the ability to make changes at those levels, so local, regional, international, national levels. And you have the ability to change either standards of care, standards of practice, procedures, guidelines, or policies, anything like that that relates to a far more reaching level than just your local hospital or region that you're working with. And effectively, the competencies that the RPS require are split into 5 domains. They are person-centered care and collaboration. They are professional practice, leadership and management, education, and research. And it's actually being at a mastery level in your chosen area of practice or topic. That is key to this.
And I love that. And it takes a long time to kind of get to that point. How many years have you been within the respiratory and paediatric space now?
So the paediatric space, I was in 9 years before I had the children, but that was all encompassing. So everything, PICU, cardiac, respiratory. In respiratory itself, probably a good 8 to 10 years.
That's a considerable amount of time. And there are differences, obviously, between different consultant pharmacists in terms of how much experience they have. But this is a good guide to say, actually, yes, if you're working to that level of mastery, you kind of need at least sort of a decade's worth of experience to get to that point where you probably feel comfortable and competent enough to start the framework itself as well. Can you tell us maybe about a complex case that you've dealt with that was at a level of a consultant pharmacist that differentiates you from a non-consultant?
So an interesting one that I had was a couple of years back, just after COVID, where what had happened is the COP, I think it's 26, I don't know which COP it is, but the COP recommendations came about saying that the NHS had to really become a lot more sustainable, had to look at sustainability to save the environment, and everything that, a huge document came out on NHS sustainability and how people could go about doing that. And one of these aspects that came about in the media was about metered dose inhalers and how metered dose inhalers, by the way they worked, cause an effect on the ozone layer, which is very good to highlight. However, what our concerns were, and something that we heard on the grapevine and whisperings by youth, was that people were giving up the metered dose inhalers because it's the young people that are really sort of going for being environmentally friendly, becoming vegans, and lots of different things. And I didn't see it myself, but we were concerned that people would stop using their inhalers. And one of the concerns was, if you stop using your inhaler, that's no good for the environment, because good asthma control is good for the environment, because a journey into A&E, ambulance, spending a night in a hospital is not environmentally sustainable. In fact, it's less environmentally sustainable than one MDI inhaler. So we wanted to get that across to the youth, to the parents, and to hospital providers. So we wrote a leaflet with NHS England. I collaborated with my colleagues, and we wrote a joint leaflet that was for parents about green about being environmentally friendly. So good asthma control is not only good for you, but it is good for the environment. So we wrote a leaflet. The other thing we did was we know that dry powder inhalers are environmentally better than metered dose inhalers. However, we didn't want blanket switching so that everyone just went off and did this, especially in children. If you've got neurodiverse children or children that don't like powder, or different reasons that they don't like it. So anyone from sort of 10 and over could try this dry powder inhaler. So we wrote a top tips guide for GPs and healthcare professionals on how to go about doing it a step-by-step in a way that would encourage young people to adopt using dry powder inhalers.
And that's really interesting because obviously you're using your clinical expertise, but in this case, you're demonstrating a lot of leadership. You're working at a national level to get information out on quite a large scale, but you're also using your educational skills because you're having to create leaflets and provide information which is understandable for the general public as well. So it's showcasing that actually it's not just about the clinical expertise when it comes to that level of mastery as a consultant pharmacist. You have to have quite a broad competency base in order to kind of get to that point.
Yeah, I mean, that's correct, because you need your clinical skills to know which inhalers or what is the most appropriate thing. You need to understand the complexities of the patient population you have. And that's quite important to, it's quite difficult for children, actually, that we differentiate the differences between children and adults, because what may be relevant in adults may not necessarily be relevant in children, although there is cross information, and it's similar. Sometimes you are dealing with a different population with parents and children. So it was quite important to get that out there for children.
Yeah, I love that. Let's think about, I guess, when it comes to competencies and clinical skills, at this level of mastery, how do you keep yourself up to date and how do you keep involved with all the advancements that are happening in your area of expertise?
It's quite difficult, actually, because sometimes there is too much information out there, and it's really difficult to know what to tap into. But what I have found are my networks. They're amazing. So, like the MPPG, the networks that I've made through that, the LNPPG, so the London Neonatal and Paediatrics group, and the Neonatal Paediatrics group have been amazing because you get lots of circulars. You get different people that are able to communicate through either email, WhatsApp groups, and some through Twitter. And so you hear about different things, and then you can then go in and delve into what is appropriate for me and home in on and focus in on what you need to progress and get involved in. And sometimes it comes through you by different routes through your other networks, like the asthma network that I belong to in Southeast London, Northwest London, our London groups, so things like that. But also webinars and conferences. I love conferences because you learn so much more and you meet so many people that are like gurus in their own field. And it's so good to listen to them and be inspired by them and then think, well, yeah, if, this is the way, forward. And also, like, I've been really lucky. I've worked in a very, in environments that are very pro-education, pro-research. And I find that if you work in organizations like that are very sort of pro-education, pro-research, innovation, that you quickly are moving in that way towards innovation, towards, recognizing that you can do a lot. There may be a lot out there, but actually there's still more to do. And it's recognizing that and acknowledging actually there's more to do.
Thanks for sharing that information. I also wanted to say that I really personally enjoy coming to conferences or attending national meetings or groups that I'm part of because it helps me to think outside the box. It gives me ideas of things that other people are doing that I might not have thought of that really help me to advance my career. So I love that you also enjoy being part of different groups. And we've been to conferences at the same time and really, really enjoyed those experiences. So it's really valuable to share that with people out there that don't try and do everything alone. It's really good to have that network, to have other people around you that are also going to help you to rise up and use that as a tool to then grow and become the consultant pharmacist that you want to be. from my point of view, I wanted to ask you what you think about the evolving role of a consultant pharmacist and where you see our skills developing over time over the next few years.
Yeah, so just going back to the conferences, I think it's more like meeting a family member. And if we remember that one brain is better than, more brains are better than one brain. And, it's a lot more powerful, and different people think in different ways. So you can learn so much at these conferences and meetings and things like that. So the evolving role of a consultant pharmacist, I think we're doing really well so far, but we have a way to go. Because if we look at the medical model, there are quite a lot of consultant positions out there in every speciality you can think of, and that's both in adults and in children. Currently, there aren't enough roles for consultant pharmacists. There aren't enough specialist roles, like my role is just pediatric asthma, and that's what I've credentialed in, and that's what the post-approval process has approved. Um, However, what we tend to find is that once you become credentialed and recognized at a consultant level, to actually get that position in that specialist role is a lot more difficult and a lot more trickier. And I'm not sure whether that's due to resources or whether we're not recognized in the same way. But from my point of view, I think it's more to do with resources and getting this appropriately resourced so that that pathway is really looking good, very much similar to the medical model. And I think that's what I'd like to see in the long term, that the resources are there, the different specialists are there, so that people can grow into and apply for those consultant positions.
Yeah, I love that. And I think that would be really useful as well, because I think when you look at the portfolio that you have to create and the actual pathway that exists at the moment, people do feel a little bit overwhelmed with the journey. And I hope that obviously this podcast series provides them with some really basic information that will guide them or inspire them to follow this pathway. And part of the series will also include a little bit more information on that in other episodes, which is amazing. I also wanted to ask, in terms of your clinical expertise, what has been the most valuable training or certifications that you've received that have helped you on your journey?
Well, definitely the basics, so your certificate, your diplomas, and things like that. And then specializing in a particular area, going into a specialist field that you're interested in. And I found that doing my MSc in research really helped me with this, because you really need to delve into that particular area, especially if you're doing a research project. And it made me realize that actually there's a lot to do in this area. And there's a lot that I was interested in this area, and there's a lot of improvements to make in this area. So the first thing is to find that specialism, actually, because that can be quite hard. You don't just become a consultant pharmacist because you want to. It's because you're interested in a speciality and you want to do something in that speciality. And I think that's quite key. And then and definitely doing the consultant credentialing really helped me a lot, because it made me recognize and realize that I have done quite a bit, and that it helped to triangulate my life's journey and made me realize that I can work at a mastery level and that I can specialize in that particular area that I've chosen, because I had the evidence to prove it. And that's quite important to do that you have shown that, you can do that. And in terms of like training, I found that working in an organization that is very good at training and education, that is very good at research, that is very good at valuing pharmacist roles to consultant level, really helped me. And there are people around me, my peers, that I look to, and their pathway and how they've grown into that role. And I look at different models and look at what they've done in their training and try and replicate that and more, so that, I am absolutely specialist in that role. But also, it's not just pharmacists, it's also your MDT. it's your medical colleagues, it's your nursing colleagues, because they're they're consultants, consultant nurses, consultant physios. So just having a look around me at the training that they've done, and then continuing on that. So, for instance, recently I've started doing the ARTP spirometry training. Now, it's a lot of work, and but I realized that actually we do spirometry, but I can't actually interpret it properly or comfortably. I can recognize bits and pieces, but I can't do it properly. So I'm doing that. And another thing that I'm doing now is something on coaching, because I realize that children that I work with are non-adherent, especially the adolescent population. They're not taking their medication. So how can I better have the conversations with these people? And actually, there's a coaching apprenticeship that's coming out that I would love to do. I'm going to apply for that so I can just be better at giving the advice and giving the advice to that young person or that child, to encourage them to take their medication.
That's so interesting. And what it kind of raises to me is that it's a continuous journey of learning. It doesn't really stop. You can reach this point of mastery, you can become a consultant pharmacist. But because the role evolves, how you manage your patients and what you do in your day-to-day role will always evolve, that you will identify new things that you have to learn along the way. And I love this experience of doing consultations and thinking, actually, I can improve the way I approach patients and parents. And a course in blah, blah, blah will help me to kind of achieve those skills and be a better practitioner, be better at being a consultant as a consultant pharmacist, and kind of leveling up on that mastery that you've got. Thank you so much for sharing this journey with me, Sukeshi. I'm so happy to kind of kickstart this journey with a friend. Thank you everyone for tuning in to episode 1. I hope that gave you a taste of what consultant pharmacist life is like. On the next episode, episode 2, we will be learning about all the different specialist areas that you can go into as a consultant pharmacist, as well as the challenges and some of the opportunities that you will experience along the way. So tune in to that episode soon. In today's fast-paced world, stress can impact every aspect of our lives: our mood, our sleep, and our ability to cope. When stress builds up, it can leave us feeling exhausted and overwhelmed. Let me tell you about a product I found called marine magnesium from the Naked Pharmacy. Derived from pure seawater, marine magnesium offers a natural solution to support nerve and muscle function. It helps stabilize your mood, reduces your stress, and promotes better sleep, so you can face each day feeling refreshed. You can order it now with code PD20 for 20% off, helping you find balance in a hectic world.